Hey, hello everybody. Dr. Randy Wertz in Thrive Chiropractic. Hey, let's talk about these kids. They're just struggling, and I want to talk about the word easy. Easy, meaning that there is struggle, that it's not easy for these kids, but it can be easy. And I want to give you some action steps that you're going to be able to take to discover what is the answers, what can provide you hope, what can give you some solutions to what's happening with these children that are struggling in life, and not only just struggle but the family struggles as well. So when we start to talk about what's not easy, let's face it, life's not easy for these children. Getting up can be a struggle. Routines can be a struggle, as simple as getting breakfast or sitting in the chair during family meals, or even listening or paying attention, or they're bouncing off the walls, or they're just not focused at all. There's no expression on their face. They're not making eye contact. And above all, they're not getting along and having the relationships maybe with other siblings or you as well. And it starts to have an effect, not only on them socially, but you socially. You can't go out to the grocery stores amidst the many things that are going on now. But you feel secluded. You're struggling. You don't have the answers. You've been to everywhere. I've been to the OTs, the PTs. I've done the essential oils, and those help. But it's just not getting the job done like we wanted to. Something is just not working out. And as far as taking the red dyes out and watching what they eat as far as the gluten and doing the detox, those are just not helping. They're not getting the job done the way you thought they would be. So life is a struggle, not only for you, but your children and the people that surround them. Now, what is not working, else that's not working easy, is their nervous system. Now, you're going to find that this approach is different because I don't look at necessarily the behavior, the motor skills, your kids tripping over the feet, the emotional meltdowns, not getting along with other siblings, or not getting along with other kids in preschool once those start up again, but the immune system as well. And those will start to have an effect on the behavior. But what's driving the behavior in these children? What's having an effect on everything in the body? So as a chiropractor, as a prenatal chiropractor, as a pediatric chiropractor, and family wellness chiropractor, we start to look at and ask a different question. What is the cause? What is driving the function of the body? And we look at the nervous system, because these kids' nervous system, they're stressed. They're not functioning the way they're supposed to be. They're functioning with distress, with dis-ease. They're not easily working. And when the nervous system gets scrambled through events in their life, and we're going to talk about those events, that nervous system is not interacting with the environment, not interacting with people, not interacting with their parents or with food or the bugs that are going around in their environment, or their motor control the way it is programmed to design. There's a discoordination. Let's face it, the nervous system is what perceives everything from your environment, even the internal environment, from the food we eat, from the external environment, to as simple as walking over a step or walking in general, or crawling for these children. That may be delayed. It's often delayed. That they have poor motor control. They can't hold their head up straight, or even setting up is a challenge at an appropriate age for these children. So we start to see that that's a history that starts to come into play. And what's not working easy is their nervous system, because it's not coordinating all these things. There's poor lack of communication between their brain and their body, and their body and their brain. And that nervous system that's working so hard, that's working and not struggling and not coordinated correctly, not set up to function in the environment they're in, that's a struggle. And what's causing this? So what causes this nervous system to not work correctly? And we look at a case history, and we start to see that when I start to see these kids with case histories, and other chiropractors who I study under start to see a common pattern, the perfect storm that we start to look for in these children, we start to see it come together. Just like the weather, you start to see the dark sky clouds, the barometric pressure go down, the dew point goes up. We start to see certain indicators that weather will start to have an issue. Well, same thing with these kids, where these perfect storms in the weather start to come manifest. Well, these storms these children are dealing with in their nervous system, the perfect storm in their nervous system starts to manifest too. It even starts before they're born, where we start to see a handful of these kids that moms and dads were having a problem with conceiving because of the stress in the parent's life, because of the stress on their nervous system. We don't tend to invite children into this world if the world's stressed. We have to worry about our own survival. So we start to see that when moms and dads are having problems conceiving, that's an issue. The next step, where we start to see pregnancy as a struggle. Pregnancy as a struggle where, baby isn't positioned correctly, or baby isn't moving correctly, or moms are having chronic morning sickness time and time and time again, or they're making multiple visits to the hospital because blood pressure is going low, or they're working 50 hours a week up until the first day of their pregnancy when they start to go in labor, and some moms are even doing it then too, because they feel the pressure of just working and succeeding, and they have to have that. They're trying to support their family to make ends meet, and we start to see that has an effect, because there's a lot more than what happens as you nurturing blood and giving that baby life through the blood. It's the control, it's the stressful environment that you live in, is a stressful environment that those children are living as well. And we start to see that when those children are living that way, and we start to see that 80% of these children have a difficult birth, that they either use forceps, and God forbid an emergency C-section where they were born early, we start to see that these children didn't have a beginning to life. So easy beginning to life is not there as well. So they have not an easy life. They have a nervous system that's not working correctly. We start to go in reverse, and we start to see that life, the beginning of life, was not easy for them as well. And then it starts to show up that life is not easy for you. Life is not easy for you because it's not easy to do this on your own, parents. And I see this. I see this with the moms who just beat themselves up emotionally, thinking, I don't know what to do. I don't know where to turn. I just see my baby who's helpless, and I can't do anything about it. And moms, I know it's it's easy for me to say, don't beat yourself up, but I know it's hard for you. I know it's hard for you because I see it on your face. I see the exhaustion on your face, and the emotional wear and tear on your bodies is not there. So let's have a plan. Let's pull out of this and become a plan so that life can become easier for you. So we can switch the dis-ease in your child's life, in your life, in your family's life, into a thing of ease. And to do this, let's look at the nervous system. Let's look at how we can get that nervous system to work properly. Because I can tell from the case history that the nervous system's not working properly. But I can also need to understand what is actually where the problems are. And that's why I do the exam. That's why I do an exam to understand, hey, pinpoint where the issue is, where the disease and the problems are, and the dis-ease in the nervous system, where there's a subluxation. That's the term that we chiropractors will use when there's dis-ease in the nervous system. There's a stressed out, subluxated nervous system that's not allowing your children to function correctly the way they're programmed and designed to function. Their computer and their body, their brain and their body are just not meshing up. They're meshing up like this, and they're not connecting where they need to mesh up like this and living in harmony. So they're communicating back and forth. And what I do is I invest in this technology where we can pinpoint, computerized technology, where I can pinpoint exactly where those problems are. I can see how much of it is. I can quantify that, and it's easy for them to do. What else is easy is taking action. What else is easy is that you can take the action. You can do one of two things. Hey, I realize this might be the first date for both of us. I'm not going to ask you to get married on the first date, but you can take an action step, and I invite you to our Perfect Storm workshop. I invite you to the Perfect Storm workshop where you can click the link and just sign up, and then we invite you to look at this. Now, if you can't make this, I understand. Hey, life happens sometimes. Life happens where you can't make it at a 8 p.m. appointment to do a virtual workshop over Zoom. I got it. What we can do is I can send you that afterwards. I can send you it so you can chunk it down in 20 minutes or 15 minutes on your time schedule so you can get the answers. You can get the hope that you've been searching for that we can do. And I realize that maybe right now you're just ready to take action. So let me know. Watch this video to its end and let me know by giving me a call up and say, I'm ready to do something now. And we'll definitely take the risk out of it. As far as the monetary risk, we'll substantially lower that intake, that exam. That's usually $175. in the office. We can definitely lower that for you so you can understand there's a minimum monetary risk. And timing. Hey, let's face it, once I send you the paperwork and I get a chance to study that and write, I write and take notes on this and dive deep into this so I can ask you the questions as well over the phone, so you're not in here. Obviously, you'll feel safer too, but when the child comes in for the exam, we can hit the ground running. And then I can do a report if need be over the phone or by Zoom too, so we can make that easier for you. And then you can sit there and say, hey, what do we decide? And you know what else is easy? Care. Because a lot of times people think that care for an adult is the same thing as care for a child, which is not the case. We use a simple little device. We use the body weight. It's an easy click right there. Call it the popcorn machine. This becomes a toy for kids. And later on, I plant the seeds for them to be chiropractors. Hey, let's face it, I'm always recruiting too. So a little fun that we like to have in here too. So we use use our body weight to adjust them. And sometimes for babies, it's as easy as this. It's really light adjustments, very pinpoint, exact adjustments. So I don't have to force anything, because you should never have to do that with a child. Just force it and do that. So care is easy. You know what else becomes easier after this? Life. So you know the life that we talked about at the beginning of this video? The life that ends and the transition starts to happen, because I've seen it. I've had it written in the testimonials. I see it on the faces of moms when they come in and they're getting their night's sleep for 5 hours instead of every half hour they're up, or they're rocking their baby upright position. I see it on the people that say, Dr. Andy, you understand me, you're listening to me, and you're not dismissing what I have to say as something that is just something that we see as just normal, starts to become common, and it's just everything, where you as mothers are validated to say, hey, your intuition is serving you correctly. It's not just a phase. And your children start to respond better with routines, with getting up in the morning, with eating foods that are healthier for them now and actually enjoying them, and starting to interact with you and have fun. And they might even start to giggle too, and start to run around when they're not tripping over their feet from time to time and falling and getting black eyes, where they're coordinated and they're starting to crawl. And those bugs that seemingly send everybody into a tizzy, where they used to be into a tizzy, are just a common everyday occurrence, where they don't get sick at the drop of a whim, and they're not refluxing, or they're not having that colic that started out. Because we see that perfect storm that started from even pregnancy to birth to adolescence, where they're colicky, starts to change the course of their life. Where their life that they're declining and they're struggling with is going to change 2 years from now. It's starting to change 5 years, 10 years, where their outcome is going to look a lot different because of the decisions you make now, the decisions you make today. So I invite you, either, hey, watch the video and invite your people, or you might know somebody that is needing this and needing this information. Click on the link, sign up for our virtual workshop, the Perfect Storm Workshop. Or, you know what, if you need to give me a call, you need more questions, you want some direct questions to answer me, by all means, we'll probably answer those. And I know we're going to answer a great majority of those in the workshop. But if you can't wait, by all means, I'm here for you. That's what I'm here to do. I live for this. I live to watch kids flourish and to thrive in life rather than just survive. And I realize that it's just not those kids that are thriving. I know that families start to thrive again, and that just juices me up. I love seeing that. And I love seeing moms and dads and kids come in for the first time when they have the breakthrough. Where we get to celebrate that. We get to celebrate life and health, and we don't get to focus on sickness anymore. Where we get to say, this is the potential, and we start to see hope. We start to see the answers are getting answered, our questions are getting answered, and we start to see life come back into the family again. That's what I'm about. That's what I want to see. So I invite you, click on the link. I'd be happy to have you join us for our next Perfect Storm workshop, where we can give you the answers and we can give you the hope that you've been searching for. Hey, this is Dr. Randy Wirtz in Thrive Chiropractic, your family pediatric prenatal chiropractor ready to serve your community. Take care. Bye-bye. God bless.